In general, the easiest way to manage post-operative pain is to use an opioid and to use paracetamol and to use an anti-inflammatory medicine. Now, the reason it's so useful in the acute setting is that it can be weaned down quickly, because acute pain gets better quickly and the opioids can be ceased. Things go astray somewhere, and that's where there's leakage of the opioids into the community, or patients start taking more and more rather than less and less.
I mean, acute pain is caused by trauma or disease, and possibly the most common occurrence is post-operative pain. And there we know that it is very important to treat the pain, because if you are lying in bed not moving because of the pain, you will delay your recovery, it will take longer for you to rehabilitate, and you can develop problems like thrombosis or pneumonia by not being active. So for such conditions, it is extremely important to treat the pain, and I would dare to say to treat the pain aggressively. And the current concept here is the one of multimodal analgesia. And that means that we are trying to combine specific drugs targeting specific parts of the pain pathway so that they work together, and thereby you improve the pain relief by reducing the side effects of the drugs you are using. What is important is that one discusses with whoever looks after you that non-opioids should be used as far as possible, and that in particular, when there is no contraindication, an anti-inflammatory drug is used, because a lot of the pain in acute post-traumatic and post-operative pain is caused by inflammatory mediators. And these drugs are specifically targeting these, and therefore, for example, pain relief on movement is much better controlled with these drugs than an opioid would ever do. That doesn't mean that there are not situations where the pain is so severe that non-opioids alone are not effective, and then there is a whole range of things specialists can do in a hospital. You have possibly heard names like ketamine, for example, or pregabalin and gabapentin, which might help in certain conditions here. But very often you will have to rely on an opioid, at least for the breakthrough pain, for example, on mobilization.